So why do I have a speedometer written on the board? Because I want you to understand that how we name rhythms, especially when nurses are learning new rhythm names, and there's all different names, and what's a tachycardia, and why are these accelerated terms used. So I just wanted to draw a little illustration here so you have an idea of how, again, going from the sinus node to the junctional to the ventricular, the function of the heart, and how we come up with some of these names. So I will draw this as I explain it, so pardon my back. So if we think about it, a normal sinus rhythm functions at a rate of 60 to 100, okay? So what do we call a rhythm that is 60 to 100? A normal sinus rhythm, okay? What do we call a rhythm below 60? That is a sinus brady, okay, sinus bradycardia. What is a sinus rhythm over 100? Anything over 100 with an asterisk is a tachycardia. So this is an S-tac, a sinus tac, okay? So the next rhythm, as we go down the heart, we pass through, we have a problem with the SA node, we're now down in the junctional tissue. So if you remember, the junction functions at 40 to 60. So when you have someone in a junctional rhythm at a rate of 40 to 60, it is called a, yes, junctional rhythm. So we know, because we said anyone who has a rate over 100 is a tac. So if we are going to follow this through using the same thinking, anything over 100 is a J-tac, a junctional tachycardia, okay? So I have a junctional rhythm at a rate of 40 to 60 and a J-tac over 100. So what do you call the rate between 60 to 100? So God bless the person that came up with this name. It's a little faster than junctional, so we're going to call it accelerated junctional, okay? Accelerated junctional. So now that you know how that goes, you should be able to figure out what the names are for the ventricular rhythms. The ventricular rhythms, if you remember, occur at a rate of 20 to 40. So these are ventricular or IVR rhythms. So now we're going to get rid of this next section. And using the same thinking we did for junctional, what do you call a ventricular rhythm that's faster than the native beat of the ventricular tissue, which is 20 to 40, but not fast as a V-tac? It is accelerated ventricular. So you can see your ventricular junctional sinus go together, and then those rhythms that fall between a normal rhythm and the tachycardia is an accelerated. And then what is the ventricular rhythm over 100? It is V-tac. So there is one rhythm that I did not include here, and this is the atrial tachycardias. And in the lecture, I talk about how the atrial rhythms are all abnormal rhythms. So the normal sinus rhythm, the normal function of the sinus node, if you have a sinus tachycardia, will only function up to about 150 to 160 beats per minute. So if you have an atrial tachycardia, so ATAC, begins around 150 to 160 beats per minute. There is no atrial tachycardic rate that is less than 160. So if you have any questions regarding this video, we'll talk about them in class.